Hello class, today we're going to talk about the basic heart rhythms, but first we need to look at the structure of the heart. There are the two top chambers, which are the right and left atrium, and the two bottom chambers, which are the right and left ventricle. When looking at EKG rhythms, the electrical cardiac activity begins at the sinus node at the top of the right atrium and then stimulates the atrioventricular node at the bottom of the right atrium, then goes on into the ventricles and so forth. Now that we've looked at the structure of the heart, we'll look at some of the EKG tracings and the breakdown of those. The P wave is the atrial contraction. The QRS wave in whole is the ventricular contraction, and the T wave is the atrial depolarization. As we look at the time frames in the next slide, as far as the grid paper, the PR interval will become important, as well as the length of the QRS. On the grid paper here, you will see that it'll break down in time. We look at the overall larger boxes at 0.20 seconds, and then the smaller boxes within are broken down into 0.04 seconds, so that 5.04 second boxes equal 0.20 second boxes. Normal sinus rhythm is the first rhythm that we'll look at. It has all of the baseline normal components that we look at when analyzing rhythm strips. The heart rate is typically between 60 to 100. It has 1 P for every 1 QRS. The rate is regular, meaning they can march out along the tape. The PR interval is 0.12 seconds to 0.20 seconds, and the QRS interval is less than 0.8 seconds. When you have a patient with normal sinus rhythm, you need to assess the patient, obtain the vital signs, and then monitor for any changes in EKG rhythm strips. These are some examples of normal sinus rhythm. A variation of sinus rhythm is a slower heart rate, being sinus brady. Heart rate is less than 60, but you still have the same components of 1 P to 1 QRS. The rate is still regular. The PR interval is still the same at 0.12 seconds to 0.20 seconds, and the QRS is less than 0.08 seconds. Some things to monitor with your patient here is if it's not normal for your patient to have a slower rhythm, then to assess for different things such as medication changes. Sinus tachycardia is another variation of sinus rhythm where everything is the same except for the heart rate is greater than 100. In assessing your patient, you need to assess vital signs as well as blood pressure, continue to monitor for changes, and then realize that your higher heart rate can be related to pain, fever, or medications. This is an example of sinus tach. As we move away from sinus rhythms, we're going to talk about atrial rhythms, those that occur when the atrial part of the heart do not contract effectively like they do in sinus rhythm. The most common is atrial fibrillation. What occurs is the atria begin to quiver, and you will, on your EKG, see that you will lose your P wave, as in this example, and that the QRS become more irregular along the line. This is because the SA node and AV node are not firing consecutively like they do in sinus rhythm. We like the rate to be controlled between 80 and 110, as in this example the rate is uncontrolled and much higher than 110, and these patients, they will be started with an antiarrhythmic. A variation of atrial fibrillation is atrial flutter. This has much of the same considerations as atrial fib, except for it does have very characteristic sawtooth pattern, as you'll see on the next example. For any atrial rhythm, patients need to have an EKG to confirm these types of rhythms in all strips, and will be started on an anticoagulant to decrease the risk for blood clot formation, as well as an antiarrhythmic such as cardizem or amiodarone. As we move away from the atrial arrhythmias that can occur, we're going to talk about those that can occur in the ventricle, called premature ventricular contractions, or PVCs. This is an isolated, unusually wide QRS complex that often occurs too early and is much wider than the 0.08 seconds we discussed earlier. In this example, you have a PVC that occurs between the first and third beat. The nurse needs to monitor at the frequency of these PVCs, as they can indicate a low potassium level. In this example, there is a PVC once every fourth beat. This is called quadromony. This is a PVC that occurs once every third beat, or called trigeminy. The nurse needs to palpate a pulse with this rhythm strip to see if the patient is actually perfusing these PVCs. As in this example, there's a PVC once every other beat. This can really decrease a patient's perfusion where their heart rate is actually half of what it appears to be on the EKG strip. The danger is that the patient can go into what's called ventricular tachycardia. This is a continuous line of PVCs where perfusion is greatly decreased. It can be that the patient has a pulse with tachycardia, or that they have no pulse with VTach. This is when a patient would be coding and would need to have CPR. This is an example of ventricular tachycardia. As ventricular tachycardia deteriorates, ventricular fibrillation often results. This is an unorganized rhythm on the monitor. The patient is pulseless and it occurs due to a failing heart. The patient will at that point need defibrillation and CPR and epinephrine to attempt to restart the electrical activity of the heart. This is an example of coarse VFib, and after this is an example of fine VFib, both requiring the same type of nursing care. If no electrical activity is recovered, asystole results. This is no heartbeat and no heart activity. This is what we call a flatline. At this point, there is no need for electrical defibrillation, but only continuous CPR and continual dose of epinephrine every 3 to 5 minutes according to ACLS guidelines. If at that point no life is sustained, the patient is called deceased.